So I actually cold capped. I had 6 rounds of treatment that needed the cold capping. But what a cold capping essentially does is it freezes the hair follicles at the scalp. You wear these caps that are like negative 40 degrees Celsius. And by freezing that, it doesn't allow the chemo to get to the fast acting cells, which is what chemo targets. So cancer is a very rapid growing cell, so it targets that, but also your hair is, the cells in your nose are, your like, your genital areas and like those kind of things. And so, yeah, it's a way to just kind of have it not target that. But if you, with certain cancers, you're not allowed to cold cap. So say if you have like leukemia or like a blood cancer, they want to make sure that they're getting everything. So you are not allowed to cold cap for something like that. But cold capping is such a lottery and it's dependent on what your hospital works with, what company it works with. So I did the Penguin cold cap. So basically you have 3 caps on what is it called? Dry ice. And then you're having someone swap out these caps for you like every 20 to 25 minutes. And this is like 8 hours of doing this every single time you have a chemo treatment. And then again, you never know if it's going to work. So I still lost about 70% of my hair. So the reason I chose to do cold capping was I really didn't want to lose my hair. I felt like when you're diagnosed with cancer, it takes so much of you. It takes your body, it takes your breasts, it takes your time. And I was at the peak of my fitness career, which was primarily on camera, and I didn't want to lose that. So I wanted to still feel like I still wanted to look the same and look like I was just, just get treatment and still live my normal life, which is very naive of me to think that because once you're diagnosed, your life will never be the same again. So it was kind of a form of control for me. And I quickly found out that I just had no control in all of that.